Hey guys, it's Justine Buick from the NCLEX and today I'm going to be going over some pain meds with you using my online flashcards that I made with Brainscape. And these are flashcards that many of our students use to study, and it's really one of my favorite ways to study. So let's get started. We'll start off with NSAIDs. So what are those for? What are their indication? The non-steroidal anti-inflammatory drugs. And they are an analgesic, so they treat mild to moderate pain. So really pain that would go up to maybe 7 or 8, sometimes even higher they'll use these. And then they're also an antipyretic, so they decrease a fever. What are some names of the NSAIDs? And they only use generic names on the NCLEX. We have celecoxib, ibuprofen, indomethacin, ketorolac, meloxicam, and naproxen. Those are the most common ones. What are the most common side effects and nursing considerations for NSAIDs? And I always put those together. So if you know that it causes GI upset and GI bleeding, then you would know to tell your patient, take it with food, and also to assess for bleeding. Basically, NSAIDs can burn a hole in someone's stomach, peptic ulcer disease. They're also nephrotoxic, so check those renal labs, the BUN, the creatinine, and make sure they're peeing okay by measuring that urine output. What are opioids for? Well, opioids treat moderate to severe pain, so that 8, 9, 10 out of 10 pain, usually post-op or maybe some severe trauma. The generic names for opioids are codeine, fentanyl, methadone, morphine, oxycodone, oxymorphone, tramadol, hydromorphone, and then heroin, which is an illegal substance. These meds are really highly addictive, and we know about the opioid crisis that's been going on, and so doctors are more reluctant to prescribe these, so they may not always prescribe these after a surgery so much unless they're absolutely necessary. The most common side effects and nursing considerations of opioids, well, they really kind of bring everything down, so they cause bradypnea. You'll want to assess those respirations and then hold it if the respirations are less than 12 per minute. They suppress the cough reflex. So encourage your patients to cough and deep breathe. We don't want them to end up with a pneumonia because they took too many opioids. They also cause constipation. So encourage those fluids, fiber, and walking. Get the GI system moving. They also cause sedation. So assess those vital signs, make sure they stay within normal, and then implement fall precautions. And then very specific, you'll want to use caution with patients who have had head injuries. These opioids can increase the intracranial pressure. Well, what do opioids do to people's pupils? How do you know if someone's on opioids or maybe they took too many? And they cause pinpoint pupils, so they constrict the pupils. And some nursing considerations very specific to morphine is that you don't want to give that opioid to people who have cholecystitis, which is inflammation of the gallbladder. It causes more biliary spasms and then can cause more pain. You'll want to give hydromorphone instead. And what's naloxone for? So you definitely need to know that one. That's the antidote to too many opioids. It's an opioid antagonist, and it treats that opioid overdose. Well, some of these patients are getting addicted to opioids and they want to get off of them, but they're going through withdrawal. So how do we actually treat that? Well, we will give meds. We give methadone, which is an opioid, but it's given in a way that tapers down the opioids so that the body gets used to having lower and lower doses. We can also give clonidine, and that helps calm the client down. Because when patients have had too many of these medications that sedate them, and then they're not really taking them anymore, their body starts to have this opposite effect where it starts to get really like nervous feeling. And so we really want to calm the patient down during a withdrawal episode. Well, what are some nursing considerations specifically for meperidine? And that's kind of the last resort opioid when there's no other viable options, but you definitely do not want to give these meds to children or the elderly because there is this higher risk of seizures in these individuals. Well, acetaminophen is sort of on its own. What is that med for? Well, it's the same as the NSAIDs. It's an analgesic, it treats mild to moderate pain, and it's also given as an antipyretic to treat fever. Well, what's the antidote to acetaminophen if they've gotten too much? Well, it's sort of easy to remember. It starts with the same three letters, ACE. So acetylcysteine is the antidote that you can give. So the most common side effects and nursing considerations for acetaminophen are different than the NSAIDs. So these are more likely to be hepatotoxic, so bad for the liver. Assess the liver function, those ALT, AST, and bilirubin labs, the liver labs, and then definitely do not give to clients who have liver disease, like hepatitis or cirrhosis. Well, how many milligrams daily is acetaminophen limited to? Because if you give too much, it can cause damage to the liver. So I see these questions frequently. 4,000 milligrams daily is the limit. Well, thanks so much for watching. If you're interested in getting your own membership and using my NCLEX flashcards, I'll put the link below. It's at brainscape.com. And if you're interested in tutoring or any of my other resources, you can go to my website, NCLEXtutor.com. Subscribe to my channel, like this video, and I will see you later. Bye.